Please stand by. We're about to begin. Welcome to Progress Pays Off, a webinar hosted by Power to Decide. This call is being recorded.
Thank you and welcome. My name is Julian Teixeira. I'm the Vice President of Marketing and Communications at Power to Decide, and I will serve as the moderator for today's call. Today's webinar is regarding new analysis released by us today, and it will last an hour duration. We will have two speakers, and afterwards we will have a question and answer. So if you could please keep your questions until the end of our presentation, it would be greatly appreciated. Today we'll talk about the declines in teen pregnancy and childbearing that have led to billions of savings nationally. For more than 2 decades of investments in prevention programs and services, they have led to significant declines in unplanned pregnancies and birth rates among teens in the United States. This is new analysis being released to you beforehand. We will release it to the public on Wednesday. And from Power to Decide, the campaign to prevent unplanned pregnancies. Our analysis, the overview, shows declines in teen pregnancies have resulted in public savings of $4.4 billion in 2015 alone. I'd now like to turn the call over to Ginny Ehrlich, our CEO of Power to Decide, who will talk about who we are, our brand, and the importance of this analysis. Ginny.
Good morning and good afternoon. This is Ginny Ehrlich from Power to Decide. We are so grateful for you taking the time to be with us today as we release these very exciting findings. Bottom line, progress pays off. And we're excited about that because by virtue of all of the work that the collective of people in states, communities, at the national level, and all of our partners, many of whom are on the phone, have done over the past 2 decades, we've seen tremendous progress. And we've seen the opportunity for young people, no matter who they are, where they live, to have the power to decide if, when, and under what circumstances to get pregnant. We know that first and foremost this matters to young people themselves, that young people can live life on their own terms and based on their own intentions. We also know that there's a secondary effect of that that's also very important, which is that by virtue of all the work we've done around quality sexuality education, by virtue of increasing access to no copay contraception, that we have seen a return on investment. And so today we're here to share a little bit about that. And before I turn it over to Colleen Kay to share the findings of our research, let me say that we see this as an amazing sign, and an amazing sign that all of us collectively need to ensure that we continue to make information available to young people, to make sure that contraceptive access is expanded even beyond where it is now, and that young people believe that they matter and that they have the opportunity and agency to decide if, when, and under what circumstances to get pregnant. So as Colleen will mention, we've seen savings as a result of our investments in prevention, and we know that we need to do more. And by doing more, we have the opportunity to not only impact the lives of young people, but also to better invest our public dollars. So with that, let me turn it over to Colleen Kay, who will share our findings, and first congratulate Colleen and her colleague Allison Ng on all of their amazing work to bring this to fruition.
Well, thank you, Jenny. I appreciate that very much. This is Colleen Kay. I head up our research efforts here at Power to Decide. And as Jenny mentioned, there are many reasons why ensuring that young people have the power to decide if, when, and under what circumstances to get pregnant matter a great deal. We know that this helps young people fulfill their potential, realize their goals for education and employment, and begin their families on their own terms. We also know that ensuring young adults have information, access, and opportunity requires many efforts to come together, efforts that many of you participating in today's webinar have shown a great deal of leadership on. Particularly efforts on the part of policymakers, program operators, practitioners, educators, and influencers. And we want to stress that while the dollars and cents behind prevention is but one, we want to stress that the dollars and cents behind prevention is but one reason why all this matters. At the same time, it can be a compelling set of results in making the case and supporting the valuable roles that all of you people play, particularly at the policy and programmatic level. So the project objectives that we set out to meet, we wanted to estimate the public savings that result from the declines in the teen birth rate. And importantly, we wanted to produce these estimates at both the national and the state level. As we just said, there are many reasons for this, and there are many approaches that one could take in terms of helping ensure that young people have access, information, and opportunity. The dollars and cents results that we're presenting here are just one part of that narrative, but we found that in the past, and we expect that going forward, providing these kinds of return on investment results can be very powerful from just an objective kind of empirical platform. So as Julian said at the top of our discussion, to get straight to the headlines, the amount of national savings each year that are attributable to declines in the teen birth rate between 1991 and 2015 are $4.4 billion nationally. At the state level, of course, it ranges a great deal, and we'll get into this in more detail soon. But those same annual savings attributable to the declines in the teen birth rate between 1991 and 2015 range from $3 million to $596 million each year. When we undertook this analysis, we focused on two different measures of savings. The first reflects the annual savings that already accrue due to declines in the teen birth rate that have happened to date. For this, we began by estimating the number of births that would have occurred in 2015 had the teen birth rate not fallen. We then multiplied that by the cost, the average public spending that occurs for each birth. Finally, we applied a discount factor because we recognize that even though some of these births did not occur during a young woman's teen years, realistically, some of them probably happened in her near future, perhaps in her early 20s, and may still have resulted in public spending. So we take that into account for our calculations. So that's the first measure, that is those savings that are already accruing each year due to the declines we've seen to date. Our second measure focuses on the additional savings that could be realized if all unplanned pregnancy and the births that follow are avoided among teens. Our starting point here was the number of teen births that occur in 2015. We then multiplied that by the share of teen births that follow unplanned pregnancy as opposed to planned pregnancy. And nationally, that's about 75%. We again multiplied that by the average spending for each birth, and again multiplied it by that discount factor that takes account of the fact that some births, while averted in the current year and during the teen years, may actually occur as a teen is a young adult. So now we'll say a bit more about what underlies each of these components. In looking at public spending, we included four main categories. One is associated with the health care that results during the prenatal, labor and delivery, and postpartum periods for the mom, and 1 year of infant care for her child. We also included the public spending that is attributable to benefits paid out through the WIC program to teen parents and their children. Similarly, benefits for basic assistance through the TANF program. And finally, assistance paid out through the SNAP program. We chose these categories for a couple different reasons. First, each of these can be directly tied to pregnancy and the birth of a child. By and large, these costs would not be accrued were it not for the pregnancy and birth of the child. We also limited our scope to those costs that for which we felt we could produce reasonable estimates across all states. We'll go into the methodology for calculating each of these categories shortly, and the methodology will differ category by category because it's driven by the data that we had available. So first, how we measured public spending for the medical care costs. In essence, we calculated the average spending that occurs for each birth and 1 year of infant care through the Medicaid program. For this, we were able to use data through the Medicaid Max analytic files for 2010. These data are incredibly comprehensive, both in their coverage of claimants as well as in the amount of information that we have on each claimant. So we were able to sum all Medicaid payments for claims that were either they were fee-for-service claims and they were affiliated with medical diagnosis codes or procedure codes that are related to maternity care or that 1 year of infant care. Or if they were managed care claims, they were filed during that pregnancy through postpartum period for the mother or during that first 12 months of infancy for the child. Using these data, again, we were able to come up with the average Medicaid spending for each birth and 1 year of infant care. Now, those were for 2010, so we then needed to inflate those costs. And for that, we used a data source called the HCUP-Net, which is an online tool one can use to look at, state by state, the hospital-related costs of providing care specific to particular diagnoses. So, of course, we focused on those same maternity-related diagnoses, and we were able to calculate between 2010 and 2014, which is their latest year of data, what that increase in hospital-related costs are specifically associated with Medicaid claims for maternity and delivery and infant care. We then multiplied that average cost, which is now inflated through 2014, by the number of teen births that were publicly funded. And for this, we used the Vital Statistics All-County Natality files, which we obtained through special requests from the National Center for Health Statistics. These give us the number of teen births in each state that were publicly funded through 2015. So that is the Medicaid piece, or the healthcare spending piece. The next category, as we said, that we looked at was benefits paid through the WIC program. Here we did not have detailed information by person in terms of their benefit levels or what was spent on each person as we did with the Medicaid program. So in this case, we basically we estimated the share of all WIC recipients who are either teen moms or their infants, and we took that share and multiplied it times total WIC spending in each state for 2015. We estimated the number of WIC participants by first looking at, so WIC has a couple of different eligibility categories. There are participants in WIC who are in the prenatal period, so mothers during pregnancy. There are mothers who are breastfeeding their infants. There are also infants through 12 months, and then there are children who are aged 1 to 5. So we took the share of the total WIC caseload that is in just those first four categories. That is pregnant and postpartum and breastfeeding mothers and infants in months 1 through 12. We further prorated that to look at the share of mothers who are on WIC who are actually teen mothers. And this we took, again, through those same vital statistics data, which tell us for each mother whether they participated in WIC and what their age was. The one category, that is mothers who are breastfeeding, we prorated it even a bit more because we know that teen mothers are slightly less likely to breastfeed than mothers overall. And we got that from the PRAM-STAT data from 2011. But writ large, what we're doing here is taking WIC spending in each state and taking just that share of it that we estimate to be associated with teen mothers and their children. We took a similar approach to TANF spending, that is, estimating what share of the TANF caseload can be associated with teen mothers and their infant children, and then taking that share and multiplying it by TANF expenses in each state. In this case, to estimate the share of the caseload that's attributable to teen mothers, we were able to get a pretty close approximation to that through the TANF administrative data tables, because in TANF, teen mothers actually make up their own eligibility category, so they are reported and enumerated separately from the total caseload. Now, of course, that gives us all teen mothers who are case heads, not just those who are within their first 12 months of receipt. So in order to narrow in even a bit further, we relied on unpublished tabulations that we received from the Administration for Children and Families. And again, once we had the share of the total TANF caseload that are associated with teen mothers and their children, we multiplied that and estimated in each state. We multiplied that share by TANF spending in each state. Here, looking just at basic assistance. TANF covers quite a few different kinds of assistance, and here we're focusing just on basic cash assistance. Finally, we looked at SNAP spending. And again, a very similar approach, looking at that share of the total caseload in each state that are attributable to teen moms and their infants, and then taking that and multiplying it by SNAP spending in each state. The data that we had for the SNAP program was probably among the least robust. We did not have any state-level administrative data that highlighted teen parents as such. So we used the American Community Survey, which also has information on SNAP receipt, on parenthood, and on age of parents and circumstances of parents. And we use that to estimate, so of all SNAP recipients in a state, what share are new teen mothers? It's a very small share. It's less than 1% actually. We merged the 2010 through 2015 data so that we could get a large enough sample. But of course, we also know that teen childbearing has gone down a great deal since between 2010 and 2015. So we further adjusted that downward to account for, among mothers, what share are teen mothers. And of course, that's a falling share. So we applied that downward adjustment to make sure that we weren't overestimating the share of SNAP recipients who are teen moms. And then again, finally, multiplying that share of the caseload times overall SNAP spending in each state. I want to pause here and again stress that spending is an important overall part of our estimates and our methodology. But again, our goal here is not to highlight what is spent on each teen mom, but rather the savings that are associated with prevention. Without question, we as a society obviously need to continue to support women while they're pregnant. We need to support prenatal care, healthy childbirth, and support their infants once they're born. But it is also essential to provide information and contraceptive options that empower women to decide if, when, and under what circumstances to get pregnant in the first place. So in addition to supporting young families, we're simply trying to make the case that supporting and funding prevention is very important as well. So as we mentioned at the top of the hour, the main headlines at the national level are that we have currently $4.4 billion in annual public savings associated with the declines in teen childbearing that we have already experienced through 2015. Looking ahead to the additional savings that could be realized if all teens were able to avert unintended pregnancy and the births that follow, we could save an additional $1.9 billion at the national level. This reflects a decline of 64% in the teen birth rate since 1991. Or looking at it another way, there are 428,000 fewer teen births nationally in 2015 than there would have been had those rates not declined. Even so, there were still 232,000 teen births in 2015, meaning that it remains critically important to continue to fund prevention efforts. And we know nationally about 75% of those teen births followed unintended pregnancies. We also know that when we add up the public spending across those four categories that I just explained, it's about $16,000 per birth. Now, these national numbers are built on the estimates that we constructed for each state. We know that for these results to be resonant and compelling, they need to reflect the situation, the programmatic situation that we see in every state and using current data. So our estimates, our state-level estimates, use state-specific data for almost every component. We have the number of teen births overall, the number of teen births that are publicly funded, the share of WIC prenatal participants who are teen mothers as compared to mothers overall, average Medicaid payments for teen maternity and infant care, the cost inflator that we use to go from 2010 to 2015, the share of WIC participants that are in each eligibility category, as well as many other things like the TANF expenditures, the share of the caseload, the share of the TANF caseload who are teen parents under 12 months of participation, and the SNAP expenditures that are attributable to teen parents. These elements are all taken from state-specific data and therefore reflecting the unique situation in each state. And then, of course, we take all of those state-level estimates and add them up to the national total. So it is very much a bottom-up calculation as compared to something that would be top-down. And here's just one example, the great state of Texas. The accrued annual savings that they experienced in 2015 alone, we estimate to be $418 million. We further estimate that if they were able to avoid all unplanned pregnancy and the births that follow among teens, they could save an additional $246 million. This reflects a 56% decline in their teen birth rate between 1991 and 2015. So amazing progress that has been made to date. That 56% decline translates into 43,000 teen births that would have otherwise happened if the rate hadn't fallen. Even so, there were still about 33,000 teen births in the state of Texas. And we further estimated that the cost for each birth was around $15,000. So those are the components that go into the estimates for this state. If we look across states, not surprisingly, there is a wide variation in the public savings that have accrued. This is driven in large part by the fact that some states, obviously we're going to see much larger savings in a state like California than in a state like North Dakota, simply driven by the size of the state. But there are many other factors that go into this variability, particularly when we're looking at states kind of more in the middle of the spectrum. A state's overall savings are going to be driven by how much their teen birth rate has fallen, how high their rate remains, variation in the participation of teen parents in their various programs, and the cost of participating in those programs. That's all very different in each state, and we capture those dynamics in our estimates. So when we see here, for example, the cost or the public spending per birth range from a minimum, as we estimated, to be $10,000 per birth in New Hampshire, all the way up to $33,000 in Alaska. And again, the average was $16,000. The percent decline in the teen birth rate also varied a great deal, from 37% in North Dakota up to 75% in Massachusetts. National average, again, was 64%. The accrued savings, therefore, we're seeing, are obviously going to be quite low in a much smaller state like North Dakota, where we see $2.5 million, all the way up to $596 million in California. Because we know that one of the most important stories to tell is at the state level and that every state situation will vary, we have put together a package of informational materials that includes a fact sheet and a press release for each state. These materials are available on the savings page on our website. I'm hoping that everybody received the embargoed link that we sent out this morning, but if not, please feel free to reach out to us. What you'll see on our savings page are the national fact sheets and the national fact sheet and press release. And below that, there is a drop-down menu where a person can select the fact sheet and press release for any state of interest. Another key feature on the savings page is the Teen Pregnancy Prevention Potential Savings Calculator. What this calculator enables the user to do, because sometimes the interest is more local than at the state level. So what a user can do is go to that tool, select their state of interest, and then within that state, select their county of interest. Once they hit calculate, the tool will then tell them what the savings is associated with the number of teen births in that county. Now, of course, this is based on the state average spending per teen birth, so it needs to be taken as an estimate rather than, a precise actuarial tabulation. But it does enable, I think, a user to drill down to the county level while still taking into account the average savings per state, or I should say the average savings per birth in their particular state of interest. Now, in some cases, so for some counties, we do not have the number of births per county, or those kinds of data are available, but only on a restricted basis. So for the calculator, we're only showing those counties for which data on teen childbearing are publicly available. If one selects a county for which the data are not publicly available, they'll be informed that for that particular county that we cannot produce an estimate. But as an alternative, a user can then simply enter in a particular number of teen births and receive an estimate back based on whatever number of teen births they enter and the county that they selected. So if, for example, a person lives in a county that is not reflected in this calculator, but that person, through perhaps that county's own public health website, can give them the number of teen births, they can enter that here. Alternatively, if a person perhaps isn't even interested in a specific county, but maybe their own city or their own school district, and they happen to know that in a particular school district there were a certain number of teen births, one can enter that number here and then again get an estimate of savings back associated with the average savings per teen birth in their state. So we think that this calculator will be a really powerful tool. We, of course, can't release results for all 3,000 some counties, but we think that this tool will be very useful for users who want to go below the state level. The last thing that we wanted to say during the webinar was, I think, in recognition that some people may remember that we have put out cost estimates in the past, and in fact numerous times in the past. We've always found that these results have been very powerful and very resonant, but what we wanted to caution here is that the results we're putting out today are in fact very different than the results that we put out in the past. The results today are framed very much in terms of savings rather than spending, and one is not simply the inverse of the other. We also have what we're using today is an entirely different methodology and entirely different data sources, reflecting entirely different categories of savings. As such, we wanted to caution people to not try to go back to our earlier results and use those to infer any kind of trend or changes over time, because they're simply not measuring the same thing. Though, of course, we hope to continue updating these new results going forward. So that concludes our walkthrough of the results that we're releasing today. I don't know if you all wanted to say anything more.
Thank you, Colleen. I really appreciate it. And I know that we'll have in a couple minutes our question and answer. And I'd like to turn it back over to Ginny Ehrlich, our CEO, who will close out our presentation part of this webinar.
Thanks so much, and just want to congratulate and commend Colleen Kay and Allison Ng once again for all of their great, thoughtful, and amazing work on this effort. And just to underscore a few things, one is that these estimates are different than estimates we put out in the past, in that we are really looking at what investment in prevention has yielded in terms of savings. We hope that especially at this point in time, that will be very helpful information at the state level, the local level, and the national level, and look forward to sharing the results more publicly on Wednesday when we're doing our formal release. We will have some frequently asked questions. We are going to field questions today, but we do hope that you, along with us, will really communicate and share the value of prevention and the returns on investment we're seeing in the work that we've done over the past couple of decades, so as to really continue our work and really make a case for continuing the progress we've made around access to contraception in particular, recognizing that our estimates show that we could yield even more savings if we were to invest in women and their children moving forward. So with that, I think we'll open the line for questions, and thank you all again for taking the time to be with us today.
We just also too want to remind everybody that all of this information is at powertodecide.org/savings. So please feel free, since you are the first people, to look at it throughout the week and to use this in the year going forward. With that said, operator, I'd like to turn it over to questions, please.
We actually have some chat box questions I think
Great.
we're going to get to first. So the first question, are all of the additional savings potential numbers annual numbers?
Yes, that's an excellent question, and they are annual. Both the savings that we're talking about that have already accrued, as well as the potential savings that would result if all unplanned pregnancy and childbearing among teens were.
Another question, how are we defining teen births?
So when we look at teen births, we are looking at all births to women under the age of 20, so 19 and younger.
Our next question, these cost estimates focus on pregnancy, birth, and first year of child's life, which is different than the cost estimates previously published. Can you talk about why you chose a different method for this study?
Yes, that's an excellent question. So to highlight the differences that that the participant was referencing, in the past we had focused primarily on the much longer term public spending associated with teen childbearing. So all the way through the complete, all the way through childhood and through adolescence. So looking, for example, at the fact that because a mother perhaps wasn't able to realize all of her educational and employment goals, she may have lower earnings. Long-term health care costs, long-term costs associated with being with systems-involved youth, and many other categories. One of the very pragmatic reasons why we're no longer taking that tack is that the data simply were not available to continue to update those long-term estimates. There was an enormous amount of complicated multivariate research that went into estimating how much more at risk a teen mother is for those situations as compared to an older mother. And we simply didn't have the data to give us a fresh snapshot of that differential. We also feel that the estimates we're putting out right now are much more in line with where the field is in terms of looking at what some of those much more direct and immediate sources of public spending are. And I think they're a bit more intuitive. And I think because they're very immediate and we're not talking about something that might happen 15 years down the road, I think it maybe perhaps resonates and it's a bit easier to explain to people.
By state, is there a way to estimate state savings versus federal savings?
So that is exactly what our estimates do. We start with estimates for each state, and we then aggregate those states up to the national number. So our savings webpage will feature a fact sheet and a press release for each state that outlines many of the findings that I covered here at the national level.
Great.
We think that's part of what makes these results so powerful.
Here's another question. Am I correct that you said that 75% of all teen births in 2015 followed an unintended pregnancy?
Yes, that is correct. The vast majority of childbearing among teens follows unintended pregnancies, which is why we think it's so important to help teens align their outcomes with their intentions.
Do you know what portion of that previous unintended pregnancy resulted in birth versus abortion?
That is something that I would want to take a closer look at rather than answer off the top of my head.
And I think you said this earlier, but can you just say again when and where the information will be available publicly?
Sure. So we're releasing to the public. I'm going to turn that over to Julian as the ultimate authority on that.
Sure. We will release to the public this Wednesday, 1 p.m. Eastern Time. At that time, the website will be public, and again, the address is powertodecide.org/savings. But if you can just go to powertodecide.org, we will have an icon on the front page that will link directly to this information.
Great. Another question we have, can you explain more on the additional savings?
Sure. So in estimating the additional savings, what that result reflects is, again, substantively, if the nation or a particular state if all teens were able to avoid unintended pregnancy and the births that follow, so if that rate were to go to 0, our estimates show the additional public savings that would result. Of course, we're not there yet, but that's the additional savings that would result if we were. And again, there it's important to point out that we are only focusing on that share of teen childbearing associated with unintended pregnancy, not all teen childbearing.
Great. Another question going back to the savings state versus federal. Are the savings separated by savings in state funds versus savings in federal funds?
Excellent question, and they are not. So we have a national level estimate and an estimate for each state, but for each state we include the aggregate of savings that would accrue.
Great. Going back to kind of looking at the old versus the revised way of doing cost estimates, will there be an effort to go back to old estimates and revise them based on new methodology, or the ability to input a year in the website to see savings over time?
So two different questions that I'm hearing there. We are not returning to the old methodology, I think for a variety of reasons. One, because as I noted before, in large part those estimates I don't think really can be reliably updated at the state level given the data that we have available to us. I also think that the frame that we're choosing now is much more in step with the messages that we want to be putting out. And that is, again, this opportunity frame, a savings frame. So for those reasons, we're not intending to update those earlier results. And then there was a second part to the question that I've already.
All right.
Sorry.
Will there be the ability to input a year in the website to see savings over time?
So I think going forward, yes. Since this is the first year that we're putting out these estimates based on this methodology and the categories of public savings that we included, this is kind of ground zero. This is year one. But we will, going forward, I think that's something we would very much like to do.
Great. Another question. Will the full methodology be published?
We will be, right now what we have are some FAQs which kind of lay out the methodology in broader strokes, and then we will be putting out a little bit more detailed report that unpacks this in more detail.
Will there be any discussion of the specific programs and efforts that have caused lower teen birth rates?
I think that's a big part of what we do even more broadly beyond this particular analysis. I think we are always looking to support efforts that are aimed at lowering teen birth rates. So that, I would say that that's almost always the case, that that's always important to us.
I don't see any other questions.
Operator, do you have any other questions?
If you would like to ask a question, please signal by pressing star 1 on your telephone keypad. A voice prompt on the phone line will indicate when your line is open. Please state your name before posing your question. Again, press star 1 to ask a question. Once again, that is star 1 to signal for a question.
I think we got another question. Did we?
Yes. Another question is through the chat box. Are AB-only efforts part of the decrease in teen birth rates?
I would imagine that the decline in the teen birth rate is the result of it's a culmination of many different efforts. I don't think our goal here is to parse out one effort over another. We know that in making sure that there is information, access, and opportunity, that never points to one single intervention or type of effort. So, and again, I think identifying exactly which effort had what impact on the decline in teen birth rates is not really the role here, but it's much more to say that prevention efforts writ large are valuable and important, and that more needs to be done on the prevention side.
Any other questions, operator?
And
Becky?
we have a question over the phone line.
Please go ahead.
Hi, I'm just a question, and I probably missed it trying to keep up with everything. But I'm looking at the embargoed site. I put in my county and then the number of like the most recent year teen births that occurred? Is that what I'm supposed to put in?
Sure. So what you should be able to do, right? Well, this is going to be an odd response to your question, but what browser are you using?
Well, that particular one is Explorer because the other browser that I'm watching the webinar on is in
right.
Chrome.
And the only reason why I ask is
Chrome would work better. Okay.
Yeah.
So
well, and we've been testing. That is correct. What you should be seeing, although just this morning it came to light that with one very specific version of Internet Explorer it was glitchy. What you should see is either or. Either you enter in a county and then you get a result, or you enter in a number.
Okay. Okay, and then if I was to enter the number, that would be logically the number that we currently have, or?
Right. So what you can do, what the calculator then essentially says is for whatever number of teen births you want to model, this is the total savings associated with that. So that could be the number of teen births in your county or your school district or whatever number that you're.
So I work at a health department, and one of the things we're reporting on is teen births defined as 15 to 17. So could I use that to put in the number of teen births 15 to 17 in the most recent years to come up with, say, this is our rate, and this is what we could say if this was not the rate?
Yes, that is correct.
Okay, great. Oh,
and so you'd be putting in and so just to clarify, you'd be putting in the number and not the rate.
Correct. Yeah, I had the raw numbers, so I could put in how many we had that age, and then that's great.
Exactly, and
overall,
I really.
Go ahead.
Oh, I was just going to say I really appreciate your question because it highlights part of that flexibility that we wanted to include. We knew that having the kind of that county drop down was great, but we also knew, to your example, that there may be interest in something other than a countywide number. It could be a particular subpopulation like the 15 to 17-year-olds or a number associated with a particular school district or a variety of other examples. And having that number box gives you that flexibility.
Can I ask another question? You got one coming.
No, please go ahead.
Okay. I'm thinking about how I can use this, and I'm also on the board of an organization that provides LARCs to women, make up the difference for that health insurance doesn't cover, or if there's no health insurance. But one of the things that we were looking at when we were founding the organization was using some of the Guttmacher numbers, and they break it out by state versus federal savings. You said yours does not do that. Would it make any sense to kind of use those ratios to just make a very rough estimate?
I would almost suggest, my inclination off the top of my head is to be cautious in that regard because I know that we included some different categories than what Guttmacher included. And I think if you're going to sort of use their results as a jumping off point, it probably would be wise to have a conversation with them as well. Okay. But off the top of my head, I would feel, I see the desire, but I would be feeling a bit cautious about that.
Okay. And is there a WIC source that shows you state spending? A national WIC source that the average person can get at? Because,
Yes, absolutely. And if you want to reach out to us, we can. So we pulled our WIC data from online published administrative data tables for WIC that show both, I believe, that characteristics of participants as well as spending levels. So those are available through. I believe it's through FNS, but if you can reach out to us, I'd be happy to send you some of that information.
That would be great. And what was your name?
This is Kelleen Kay. You can reach me at kkaye@powertodecide.org.
Thanks. Thank you.
My pleasure.
Operator, do we have any other questions?
And once again, that is *1 to signal for a question.
We have had a few other questions for people that did not receive the link already, so I said that we would be sending a follow-up email to attendees with that link.
Terrific. Operator, do we have a question?
There are no further questions at this time.
So with that, I'd like to conclude today's webinar and thank everybody for participating. As Becky said, we will send out the information so that you can go to the website And as we said, this will be available to everybody this Wednesday, January 31st at 1 p.m. at powertodecide.org. Thank you very much, and have a pleasant afternoon.
This concludes today's call. Thank you for your participation. You may now disconnect.